It's a new day in modern dentistry. You can feel like yourself again with Shatkin Mini Dental Implants. Mini dental implants are the safe, fast, and cost-effective solution to many dental issues. Do you suffer with loose dentures? Are you afraid to smile or unable to eat the foods you love because you have missing or broken teeth? Mini dental implants are your affordable solution.
I've had problems with my teeth.
I couldn't eat almost anything.
I had this big hole in my mouth.
I knew it was time to do something permanent.
I'm gonna go and get this done.
It's just unbelievable what it's done to my life.
I feel like me again.
It'll be the best, smartest move you ever made.
Kind of gave me my life back.
The mini implants are the only way to go.
Just real happy I did it.
I would recommend it to anyone.
Do it over in a heartbeat.
It's been great.
It's incredible. It is. It's absolutely incredible.
Welcome to Innovations in Health. I'm John DeSciullo. We're going to be talking about the mini dental implant procedure. It will change your life. And I'm welcoming Dr. Donald Rice, and his practice is at 7701 East First Place, Suite B in Denver. We are going to talk about the mini dental implant procedure. So if you live anywhere in the Colorado area of Denver, Aurora, Glendale, Englewood, Cherry Creek, Littleton, and everywhere in between, even Colorado Springs, you can be you again with Dr. Donald Rice and the mini dental implant. The mini dental implant is 5 times less. It's less invasive, less discomfort, less healing time, less visits to the dentist, and less cost. It's FDA approved. First of all, Dr. Donald Rice, welcome to the show.
Thank you. It's a pleasure.
Pleasure to be here with you. And I know that there are 2 kinds of implants. There's the conventional and the mini. Let's start first with the conventional implant and what that means.
Conventional dental implants are situations where teeth can be replaced. The implant is the replica or the replacement of the tooth root. There are 2 basic parts to a tooth, the root and the crown. The implant replaces the root, and from that you can build on top of the root a crown or a series of crowns. Traditional implants are greater in length and diameter compared to the mini dental implants. With mini dental implants, in a lot of cases with less bone, you're still able to place implants in the area and build on top of those implants teeth that allow you to be not only aesthetic, but fully functional and eat anything you want to eat.
And in a simple way to break it down, the conventional implant takes longer. Sometimes there's bone grafting that needs to happen. So the difference between a conventional and a mini is really significant.
It's significant in that in an area where you may not think you have enough room to make something work, in a lot of cases with mini implants, you're able to do that, and that's a tremendous advantage.
So let's talk about the mini dental implant, and Dr. Donald Rice can do this as an in-office procedure. Let's start with the lower denture. The mini dental implant procedure will stabilize it. Dr. Donald Rice, show us how.
Well, in this particular model, we have a lower denture. For our patients in this case, we've placed 2 mini implants on the left side as well as 2 mini implants on the right side. You now have 4 dental implants in total. The plastic area here represents the ridge. Now, I consider this to be a very, very healthy ridge in that it almost has, like the Denver skyline, a mountainous configuration. As a patient wears a regular denture over time, the more function they do, the flatter or more mobile becomes this ridge. So that's the advantage of the dental mini implant. It can be placed in the ridge, preferably mountainous, but if it's molehill, we can still place the implants, and then the denture will snap in place, fitting very nicely.
Now, if you have a lower denture, odds are you probably have an upper denture. Now the palate is exposed, and Dr. Rice will show us what that means with the mini dental implant example.
Absolutely. In this case of our upper denture, we've placed 6 mini dental implants. 3 on the right side for the patient, 3 on the left side for the patient. And as you can see, in a normal denture situation, this palate area will be exposed. In a normal denture, this is covered. Taste is largely the tongue, but taste and feel combined are the advantages of having a mini dental implant restoration in place. We can open up the large area, and when you're chewing, you'll feel the food versus being covered in plastic. Takes away from the taste and takes away from the feel.
Now, If the denture is all you need, Dr. Donald Rice can help you. But if you want to up your game in the mini dental implant, the Fixed on 6 is almost like a full mouth restoration, whether it be upper or lower or both. Let's take a look at a Fixed on 6.
What we have here is what we call Fix on 6, 6 being the number of implants that we placed in the upper arch for this patient. In this case, we have a porcelain restoration that is fully functional and snaps into place. You can see the beautiful restoration. There are cases in which the patient may have a lower or higher gum line. We'll even place porcelain that is gum colored and look very, very natural. And certainly the function is unbelievable.
If God gave us our baby teeth and our adult teeth, Dr. Donald Rice is going to give us a permanent solution like our third set of teeth. Take a look.
Again, a beautiful restoration. As you can see, in this case it's upper, but we also make this type of restoration for the lower as well. The difference in this case being the number of implants placed. As you can see here, we've placed 12 implants. And once we've placed the implants, we fabricate, again, a beautiful porcelain restoration. This one you can see has a little bit of gum color to it, which we will match the closest as we can to your natural gum color. And then once we've placed the implants, the restoration is cemented into place. Does not come in and out. Again, very beautiful and very functional for our patients.
Dr. Donald Rice can take care of your full set of teeth, but if you have just a few teeth that need to be fixed, for instance, the teeth in the back of your mouth, and you're thinking it's out of sight, it's out of mind, I'm not going to worry about it, that shouldn't be the case. Or if something happens where your tooth falls out, then Dr. Donald Rice is going to show us another example of how the mini dental implant will help.
Again, another example of, as John said, mini dental implants. There are a lot of us out there that, for whatever reason, we have a central tooth that is not savable. And so in this case, we extracted the tooth for the patient. We placed a mini dental implant, and from that, we matched the color of the remaining teeth, and then we place a crown and cement that crown right onto our mini dental implant for many, many years of service for our patients.
And we should mention, Dr. Rice, that that tooth is custom made for the patient. It's not something that comes out of a box and just gets placed in the patient's mouth. It's custom made and custom colored to fit the patient specifically.
There's nothing better than having something custom versus a cookie cutter.
Let's take a look at the side teeth, because as we mentioned, those are the workhorse teeth. Those are the teeth that chew your food and get all the nutrients out of it.
A lot of our patients have come in and they have teeth missing in the back, and they don't think it's a big deal when it actually is the biggest deal. As we chew food, the tongue will be, it moves the food to the back, and the back teeth actually mash the food up into smaller pieces, making it easier for us to digest and making us healthier nutritionally. So it's very important to have back teeth as well as front teeth. In the case of this model, the patient is missing 3 back teeth. What we did was we placed 4 mini dental implants in that area. We made a restoration that replaces the actual size and position of those teeth, and then we take those crowns, they're spliced together or splinted, and then we cement that on top of our mini dental implants. This patient is now fully able to function and chew their food and keep their body to the point where their digestive functions are much simpler, able to maintain health. And it's very important that teeth touch other teeth. It's just very healthy.
Dr. Donald Rice is located at 7701 East First Place, Suite B in Denver, and it's in Lowry, and the Airplane Museum is right behind you. So everybody knows where that is, right where you are in Denver on 7701 East First Place, Suite B. The number to call is 303-376-7282, and online on the web at drdonaldrice.com. So make that call, everybody. You want to make sure that you get that appointment and the consultation with Dr. Donald Rice. But now let's get to meet Dr. Donald Rice. Where did you grow up, Doc?
I grew up born and raised in Denver, Colorado.
And I know you went to a very important high school right here in the Denver area.
Correct. That would be the George Washington High School in Denver, Colorado, home of the Patriots.
Go Patriots.
Go Patriots.
Yeah. Now you were quite an athlete, and that advanced you into your college career. Tell us a little bit about that.
Well, I was blessed with some athletic ability, and I also had a passion since I was a little boy, probably age 6. I want to think it's the first time I ever shot a basketball. And from that point on, it became my love and my passion. Didn't matter the season, Didn't matter whether I was inside or outside. It was just something that I did, something that I loved doing, and even to this day, I don't participate, but I still really love the game.
Oh, you can still play. I hear you were sharing a story. You would put plastic on your hands and feet, here in the snow in Denver. That
Correct.
didn't matter. You were out there playing.
That's right. Doesn't matter. You just need a shovel so you can clean the surface off. And after that, it's a little bit cold, but you just put a plastic bag around your hands and tape with rubber bands to keep it on your hands. Man, and you go out there and shoot it. Shoot it.
That got you into University of?
Ended up, was blessed and got a scholarship to the University of Utah.
And where did you go to dental school?
Following Utah experience, I went to University of Michigan, Ann Arbor, Michigan Dental School.
So after all of your dental education is completed, you're in Michigan and you decide maybe it's time to come back home. Why?
Oh, absolutely. The great thing about Denver, Colorado is they have 310 days of sun. I was in Michigan my first year in school, and for whatever reason, I was depressed. I couldn't figure out what the reason was. I was doing fine in school. Socially, everything was good. And then it hit me probably in January of that year that I had not seen the sun for 3 straight months. And so I said, okay, well, that's the purpose of attending dental school. That's a reason to learn, to figure out what you want to do in the future. And where I'm from, the sun shines. I'm going right back home when I'm done.
Yeah, we're happy to have that here in Colorado.
Yeah,
absolutely.
Absolutely.
How long have you been in practice?
This for me is year 40.
That's terrific.
Yeah.
Congratulations.
Yeah, it's dentistry. My career has been, it's been good. It's been, I have a great practice. I have great patients. The good thing is after 40 years, I can drive into the office and before I get in there, I'm not looking at it like, oh, I gotta, it's good to see your name on the door. It's good to put your key in there, walk in, and let's get the day started.
Yeah, and your mom is a real inspiration for you.
Oh, no question about it. My mom's my best friend, and she is the reason, in principle, that I've been able to do a lot of the things that I've been able to do. She's not so much now, because she's older, but she's the ultimate disciplinarian. She let it be known very quickly that there's no timeout. Any situation that occurs that she doesn't agree with, we're going to go ahead and we're going to manage that situation right here, wherever it is. Not like when you get home, If you do something that's wrong and you're in the grocery store, that's going to be handled right there in the grocery store. It doesn't care about all that social stuff and well, we're going to call the authorities. That never entered into it. And so very respecting of that upbringing, and I think it's really helped me.
So your mom is a great guide for you and continues to be, God bless.
Continues to be right now, God bless her.
And sports, of course, very important because here in Colorado, we've got incredible professional teams and you are a fan of every single one of them.
Absolutely.
Especially
the Denver Nuggets, especially basketball. That's my passion, my love, but Denver is one of those cities that recognizes all professional levels of sport, and I certainly support all of them.
Dr. Donald Rice is a member of the ADA, American Dental Association, the Colorado Dental Association, and the Metropolitan Denver Dental Society, and you're a part of a foundation called FACE, which is very fascinating.
FACE is an organization that I'm a member of, and FACE, F-A-C-E, it stands for Foundation of Advanced Continuing Education. It's a group that's founded in the California area, and what we're trained on is how to replace teeth that may be missing, but more importantly, teeth that are generally worn down. We live in a society where a lot of times our stress is expressed by grinding our teeth. The number of people in the studio right now, I would say 80% of us are grinders. I don't know for sure, but what we do with FACE is we restore teeth that have been ground down and restore their natural length, and in some cases we'll change the color and improve the aesthetics, but most importantly, the function.
That attention to detail is what you'll find with Dr. Donald Rice at his practice at 7701 East 1st Place, Suite B in Denver. It's actually in Lowry, not too far from where anybody is in Glendale or Aurora or even Colorado Springs. And you can call him at 303-376-7282 to make your appointment. And everything online as well at drdonaldrice.com. So when somebody gets a mini dental implant or any cosmetic procedure, particularly the minis, what is their reaction when you reveal their new look? What do they say to you?
Well, in only 100% of the cases, the patients are extremely excited, probably more so the look than anything because such a big difference between the before and the after, but certainly the ability to function as well.
It does change the patient's life. Let's take a look now and meet some of the patients who've had their lives changed with the mini dental implant procedure. Take a look.
Getting the mini dental implants was a life changer for me.
If you're concerned about your looks, then obviously this is the way to go.
Not a second thought about it. I would do it again.
How could you go wrong?
I just can't say enough about how I feel.
It's one of the best things I've ever done in my lifetime. I mean it sincerely.
This is something that is so incredible.
I feel a lot more confident, my smile feels better.
And it brought a lot of confidence back to me.
It's just amazing what it does for your self-confidence and how you feel about yourself.
After the procedure, wow, yeah, you smile.
But now I smile all the time.
I am very happy I had the procedure done. I feel as though I have my smile back.
It's just unbelievable what it's done to my life.
It kind of gave me my life back.
I feel like I do have more confidence than I did before.
It's going to sound corny, but I mean, it is a life-changing event.
Changed my life.
Great to hear from all those people, Dr. Donald Rice, whose lives have been changed based on your work and that of your team. However, there are some people who still fear going to the dentist. Tell us why people should get rid of that fear.
Well, you get rid of the fear in a lot of cases because it does two things. It improves your ability to chew foods, which improves your health. It increases the number of food groups that you can include in your diet, which also improves your health. There are also situations in which patients have had bad relationships or they've had bad circumstances, and then the other reason is cost.
If they have had a bad experience or they're afraid of it in some way, you'll help them. How do you do that?
Well, I think it's very important to take a history for the patient so you get an idea of what their experiences have been, and then that gives you an idea of what's the best way to manage those situations.
You work with the patient to make the mini dental implant or any dental procedure affordable. How do you do that?
Well, you come in and we give you a price for a particular procedure that we recommend be performed for you. And most of us aren't in a position of where we can pay large sums of money, medium sums of money at one time. And so we have financing institutions out there that will help assist with payment plan for the patient.
That's very important. This is an affordable solution. So if you're out there and you need some dental work done, particularly the mini dental implant procedure, you want to call Dr. Rice at 303-376-7282. Make that appointment, and you'll find out all about how you can make it affordable and how you use what's called the cone beam. It sounds like something out of a science fiction movie, but this cone beam is the most advanced piece of technology.
Well, what the cone beam service provides is the ability to look at the teeth and soft tissues of the mouth and hard tissues in 3 dimensions. And we're able to manipulate our picture 3-dimensionally so that we can get the best diagnosis.
And I know you have what's called a quiet practice. You kind of specialize in that TLC for your patient.
We're a small practice, but we do have a door with a large window. And so each of our operatories is private.
And I like the fact that Dr. Donald Rice and his team work with you individually, so that patient is one-on-one with what you need, whether it's a mini dental implant procedure or any other general dental practice which you offer. With the minis, I know that you fly back east and you visit a dentist named Dr. Todd Shatkin back in Buffalo. And what do you learn from Dr. Todd Shatkin to bring back to us here in Colorado?
Oh, I've learned a lot from Todd. Primarily the ability to place mini implants, the ability to manage the case, the ability to do the procedures in the correct order, And in doing that, you will get the best result.
So after 40 years, you continue to learn. That's very important.
Absolutely.
And that technology is what you're bringing back to us here in Colorado. So friends, no matter what your age, the mini dental implant procedure, you can get that with Dr. Donald Rice in office at 7701 East First Place, Suite B in Denver. The website is drdonaldrice.com. The phone number to call is 303-376-7282. And technically you're in Lowry, right behind the Airplane Museum. Everybody
Correct.
knows the Airplane Museum, right?
Everybody knows the Airplane Museum.
You're right behind it, so hey, you can't go wrong. And I know that you also offer general dental practice as well.
Absolutely, that's been the basis of my dental practices through my entire career. As you practice more, you start to understand that patients have different desires, and you can start to focus on procedures that you enjoy doing more, or providing a service that you think that can benefit the majority of your patients.
So if you're seeing a dentist right now and you want to change, you can come over and see you and your
Absolutely.
team. All good. Let's talk a little bit now about, we talk about the fact that it's practically pain-free. If you have a mini dental implant procedure, what do you prescribe to the patient to alleviate whatever slight discomfort they may have?
What we do is we'll provide the services and before we release the patient, typically in situations where they don't have issue with kidney or with liver, we will give our patients a Tylenol-based over-the-counter medication, as well as an ibuprofen over-the-counter based medication. The medications act differently, and so we give them one of each to provide pain relief from two different perspectives. We'll also, in cases where we do dental implant procedures, we'll also provide a prescription for antibiotic and also a prescription for mild, moderate, or severe pain relief, depending on the procedure.
So you have got the patient covered, that's for sure.
You have to cover the patient.
And I know that the care of, first of all, care for your dental life, no matter what age and no matter what your situation, is very important. But care for a mini dental implant can also be happening with a water pick. And that's something that you offer when you have the roundhouse option.
In the case of the roundhouse model that we showed earlier, that model is cemented in place about the implants. And so there is a cement seal between the restoration and the soft tissue. What we also provide is a water pick for our patient, and it's a water pick with a reservoir. And 2 to 3 times a week, we'll ask our patient to put chlorhexidine in the reservoir and clean the mouth. Take the pick, the wick, and make sure you move it all around the periphery of the restoration to keep everything clean. Bacteria is the enemy, so you keep the bacteria away and your restoration will stay.
Good dental hygiene, always very important. And
very important.
Very important to go see Dr. Donald Rice every couple of months. Now, if you just joined us, we're talking about the mini dental implant procedure here on Innovations in Health with Dr. Donald Rice. If you've been with us for the whole half hour, you saw earlier the models, the examples of what a mini looks like. If you joined us halfway through and you're thinking, what is the mini dental implant? Now's your time to see it again. So what we're going to do, Dr. Donald Rice, in just a short amount of time, explain again the benefits. And we'll start with the lower denture. So friends, if you're out there and you have a denture and it's swimming around on the bottom of your gums, take a look at how Dr. Donald Rice can fix and stabilize your denture. Show us with the lower.
Certainly. We have a lower model here, and in this case, this jaw has been placed for mini dental implants. In cases where the patient wears a denture, a lot of times this ridge or the bone of the jaw has been reduced. Over the years, chomping, biting down on that denture will flatten this out. And then this case, the mini dental implant is very much of an advantage because it is smaller and it's able to engage in smaller areas of bone, and then it will hold that denture in place.
And now, odds are, friends, if you have a lower denture, you probably have an upper denture. Dr. Rice is going to explain to us how the upper denture example will help bring the sense of taste back to your mouth.
Upper dentures are easier with regards to aesthetics than a lower denture because you don't have the tongue to worry about. But what you do have as a primary concern is your palate. And your palate has a lot to do nutritionally with feel. And so in cases of placing many dental implants and having that dental implant hold your denture in, we can expose your palate, which helps your food feel better. It helps your food taste better.
And look how beautiful that looks. That's an upper
Beautiful.
denture.
And this is a brand new case, but in a lot of cases, what we'll do with our patients is we'll use their existing denture. It just moves around. So we can still use your existing denture, just place the implants under there. You're a new person.
Now we're going to look at what's called a fixed on 6.
Fixed on 6. Again, we've placed 6 mini dental implants for our patients, 3 on the right side, 3 on the left side, and in this case we have a porcelain restoration. Prior there had been the acrylic restoration, but in this case we have the porcelain restoration, and what we're able to do is place the mini implants. You can see the openings on the restoration that snaps onto the mini dental implants. Beautiful. All porcelain. We'll match the gum with your gum in cases where that is necessary for your smile line considerations.
And if God gave us our baby teeth and then our adult teeth, Dr. Donald Rice is going to give us our 3rd set of teeth with the roundhouse example, a fixed permanent solution.
In this case, an upper roundhouse. We also do a lower roundhouse. And in the case of a roundhouse, it is more mini dental implants. This particular case shows 12. 6 on the right side, 6 on the patient's left side. Again, a beautiful porcelain restoration. We'll match teeth shade to the shade that you desire. We will do add porcelain color. You can see that the teeth are white porcelain, but we also have pink porcelain around the periphery to match your gum color, depending on your smile line considerations. And then that restoration is cemented over the dental implants, very naturally two-sized. And again, a beautiful restoration.
Now, Doc, if you have teeth in the back of your mouth that are missing,
yes,
people think, well, it's out of sight, out of mind. Very important, those teeth are the chewers, though. Those are the teeth that do all the work. And a single tooth option as well could be a mini dental implant procedure option. Let's take a look. Show us what that's all about.
Well, we have a couple different examples here. First, we have the single front tooth. A lot of times we'll be engaged in some sort of a trauma, whether we took a fall, we're looking one way and the wall was the other way, and then when we turn, boom, there goes the tooth. So in a case like that, we'll extract the tooth because it's not savable, but we can place a mini implant in that case. And we've already matched the shade of the natural tooth, and so also the shape. And so we place the implant and we simply cement that implant into place, that crown into place over that implant.
Custom made for the patient. It looks
very beautiful effect.
And how about those side teeth in the back?
In this case, we have a patient that has 3 missing back teeth. What we did for our patient was we restored the back teeth with 4 mini dental implants. We have 3 teeth that we place and cement on top of those implants, allowing that patient to better function, chew their food, minimize the amount of work that their digestive system has to do.
And this is an in-office procedure with Dr. Donald Rice at 7701 East 1st Place, Suite B in Denver, Colorado, online at drdonaldrice.com. Phone number to call is 303-376-7282. And they're in Lowry, and you know what? The Airplane Museum is right behind you. Everybody knows where the Airplane Museum is, right?
That's correct.
Well, you are an innovator in health right here in Colorado, Dr. Donald Rice, with the mini dental implants and all the dental procedures. Thanks for joining us on our program today.
Thank you, John. Appreciate it.
You're welcome. Thank you, Dr. Donald Rice, and thank you for watching.